Hey everybody, this is Jason from Intricate Arts Spine and Body Solutions. You can check us out at intricateartseminars.com. With me today is Mark DeAnda. He's got a PT clinic in San Antonio.
That's
And
right.
we just wanted to go over a couple of things that I get asked a lot when I'm teaching courses almost every weekend, and especially from the clinic owners, is how am I going to incorporate dry needling into my physical therapy practice? How am I going to make money off of it and not lose money off of it? Because it's very complicated. It seems like if you haven't gone through this whole process. So Mark has taken all of our dry needling classes from us and our manipulation classes. So he has a really good idea of kind of how we run our company and teach. And Mark, again, owns his own clinic, and he's gone through the process of implementing a cash-based dry needling and other type of modality aspect to his clinic.
Yes.
So I guess off the bat, Mark, how has implementing dry needling into your practice changed your patient load, and just kind of how's it changed your finances, the outcome of your business overall?
Yeah. I'll just to give you a general idea of what's going on before dry needling. We would have much more volume for sure. We would book people, maybe double book them, triple book them at times. And we weren't doing any like cash-based services. It was all just insurance, right? We were playing that game. So, your typical clinic like that is, usually high volume. Patient care is, or direct time with the doctor of physical therapy is a lot less for sure, because that's very expensive. So that's how we were prior to having the dry needling in the clinic. But once we bring it into the clinic and we really started to get more buy-in from our clients, get more sales, and get them to buy packages of the dry needling sessions, all of a sudden one-on-one time increased, the volume decreased, outcomes better. So a lot of that stuff really came along when we implemented the dry needling. So it's been a blessing for the clinic. We've really just been seeing the more we do it, the more clients want it in on their plan of care, and it's just bring more value as well to our clinic, and kind of puts us honestly out of the norm. We're now no longer like in this sea of sameness. We now do a very comprehensive plan with dry needling as well.
Are there a lot of clinics in that area that offer dry needling?
I think it's becoming more popular, but having seen other clinics that actually have a cash-based dry needling aspect to the clinic, I don't see that so much. They use it more as a modality. We use it differently. We use it more like a separate plan. It's not categorized with physical therapy. We keep those two very separate. So, and that's how we sell it. It's a cash service, and it's not physical therapy.
So your clinic you accept insurance, but you do cash separately for the dry needling, right?
Absolutely.
So can you describe how you guys went about implementing that into your practice? Because I know a lot of my students ask, like, how do we, or they don't even know maybe that you can charge cash for certain things that are not paid for by insurance, and that's how it is in the
Well,
vast majority of
there's
the United
further
States.
legalities with that. So I would highly recommend, checking with your legal person for that. We have ours, Mary DuLong. She's out of Houston. I highly recommend her. We consult with her with questions like this, but it boils down to if insurance doesn't pay, then you have to have some kind of a program, cash program to offer them, and having that set aside and them understanding what it is, understanding their situation, understanding what's going to help them get to their desired outcomes. All that clarity is it's crucial when you're showing them, these cash programs. And I mean, that is a foundation to even starting a conversation about, hey, I think this cash service is really important for you.
So that, I mean, that's the other big question that I get is like, how do I sell people on dry needling? Because a lot of people think, okay, they're using their insurance for part of the treatment, and then the needling is an extra cash price. Like I think a lot of people think that nobody's gonna want to do that, and I think that's a big mistake. And it does seem it seems kind of logical. Like, number one, it's a needle that people don't really like needles in general. But just from my experience, starting needling at different clinics when I was traveling, within a couple of months of doing it, I mean, family members are asking to come in, and you got a whole new clientele of people that are really just specifically looking for the needling.
Yeah, I mean, going back to your question, Jason, when you were saying the clinician with the fear of bringing something like that, was that what you were talking about? What was the part of the question? I'm sorry, I missed that.
So, how did you find that patients reacted to having a cash service and an insurance service?
I mean,
a lot of people think that people are just going to say, no, I don't want the needling because it's cash, and I know that that's not true. But
I mean, the problem is actually it's the therapist. The therapist has to change their mentality about what the client does and doesn't want. The client, what does the client want? The client wants to get better. The client wants to get back to their lifestyle without pain, without their injury, right? That we got to bring that out. We got to really get some very good clarity, and we got to have that crystal clear, not only for the therapist, but even having that verbalized by the client. That's crucial, because we just need that kind of clarity. Perhaps no one has ever asked them what they wanted to accomplish. What was the dream outcome that they wanted with this after this physical therapy, or what would they love to see happen? These are really important questions, and I think that's going to bring huge clarity to it. Once you get those questions answered, and you say, hey, I have a very good idea how to go about this. It's going to require some needle work. I mean, that's going to be an easy transition for them to start the plan of care. But it really starts in that initial conversation, and bringing that kind of clarity to the table, and the therapist not making the assumptions of what the client is willing to and not willing to pay for is crucial. We can't make those assumptions as clinicians, right? But oftentimes we do. But oftentimes
I think that's super important, dude, because people ask me that question a lot. Like, if you had a business, and what would you charge? And I always say, I'd only charge cash. And people get taken aback sometimes with like the amount of money that I mentioned. And let's just take like $100. I usually say, like, if I had a cash business, I may charge like $100 for half an hour, or just for an easy example.
Yes.
If you think about it, people that go get massages especially at a nice massage salon or something like that, I mean, you're paying way over $100 for simple services like that people get all the time. And this isn't just something to make them feel good. This is it is, but it's something to make them overall more healthy. And you can't really you can't put a price on that. The people are at physical therapy because they want to get better, right? Exactly. So the way that I always talk about it, and I truly believe this, is I think that needling is by far the most powerful and effective tool that physical therapists have access to, as far as overall efficacy and improving outcomes, as far as the overall outcome and the speed of the outcome. It has such a powerful effect on the nervous system, the autonomic nervous system, and the mechanical stuff.
Yeah, I don't want to interrupt you, Jason, but I can't think of another tool that we have that affects, those nervous systems like that locally, and oftentimes, honestly, systemically, just generally throughout, profoundly. I mean, that's the word I want to use when I talk about needles: profound. So yeah, everything that you said like helps outcomes locally, helps them in general, gets them taps into that parasympathetic nervous system, helps them to relax more. People with high anxiety, people with dysfunctions in muscle groups, all that is you comes into play when you implement the needle work. Um, Not only that, but on the business part, I would say retention on patients. I would say that people, when they go to you for needle work and they see those kinds of results, they know you and they like you, they trust you already, they'll come back to you a year later, 2 years later, a few months later.
And it's such a good referral source also, because they'll say, hey man, I went to this guy and got needled, and all these problems I've had for years were fixed, awfully quickly. And that's not an uncommon thing to happen with the needles.
Yeah, you can even offer them, hey, yeah, I do have a referral program. So, we can definitely talk about, giving some credit, some kind of credit for some of these cash services if if you have a referral, something like that, or however you want to award them with something, a free t-shirt, whatever you want to do. But yeah, I mean, creating long-term value of that client when they come in years later, yeah, that's definitely happening here at the clinic. And then they become themselves, as long as you ask them to, right? You want to ask them, hey, do you see the benefits of this needling? Yeah. Do you have anybody that you would like to refer to us? Sometimes you got to just ask them that, and they'll give you a name and a number, or maybe they'll have them call the clinic right there. And there's another, cash paying client that you just generated without buying one taco to a referring physician. You know what I mean?
For sure.
But yeah, in that aspect, like those outcomes speak for themselves. They're powerful. A lot of times it's like, quick results. And then, yeah, you have a long-term value from that client, and also a referral source for sure.
And then I know one of the things that you guys specialize at in your clinic is facial palsies. And I just thinking about that, I think that's a very misunderstood aspect of needling from a business owner's aspect. Is I think it opens a huge pathway or numerous pathways where you can kind of sell yourself as more of a specialized clinic, so for example, like you do, treating Bell's palsy or trigeminal palsy, or TMJ stuff. I mean, there's lots of special things, women's health, incontinence. I mean, it's incredibly powerful for that. So I think you can target specific other patient groups out there. And there's not very many clinics out there that offer specific stuff like that, which I think people are really looking for.
It's really, I mean, honestly, I keep thinking of the term sea of sameness. Like you see other physical therapy clinics just practicing as if, insurance is just going to cover all their bills, and this is not happening. We're seeing that the reimbursement declining every year. You can't ignore those things that are actually happening. We have to start thinking of ways that we can figure out how to help people's outcomes without relying on reimbursement from insurance, because it's just not cutting it.
And I mean, like you said, it seems to me like at this point, it's hard to, I mean, it's almost impossible to make money running your business unless you're really, really on it with every single aspect of it. And the cash aspect just gives you a lot more of a cushion, doesn't it, as far as your revenue go? And like what percentage of your business ends up being cash now?
We back in 2017, we started with not offering. Between 2015 and 17, we didn't have any cash services, and we started with just some deep tissue laser. We did some of that, but then eventually, quite quickly, honestly, from my colleagues going to conferences and networking, they were really talking about the benefits with the dry needling. But once we started to implement that, then we'd see 10%, maybe we start at 5 to 10% of our revenue come from those cash services. But then as we started to get more and more education on selling cash services, then we went from 10 to, we started hanging around, 15 to 20. And then when back in 2000 and I gotta say 2020, when we really started to get focused on training staff, right? Training our staff, not only our physical therapists, but even our front office, right? The guys that interact with them on the daily, right? How's the therapy going? How's the progress going? When we start to train them on how to have a sales conversation, that's when we hit our 50-50 mark. We're generating 50% cash and 50% insurance reimbursement. And that's where we're at right now.
That's awesome. Yeah. So just in what, 5 years or so, you guys went from no cash part of your business to 50%.
Exactly. Yeah. And also in general, just overall, just an overall profit and revenue has been increasing. It's all been just a positive on those aspects too of the clinic, the health of the clinic, more stability during the holidays, less stress on the new year, right? Because that's when deductibles are back up to their regular unmet status, right? So
Right.
that was also nerve-wracking during the holidays.
And I think that's something that people don't realize either, is that, and this is getting worse every year too, is that a lot of people's deductibles on their health insurance is so high that they're either paying like a $60 copay or they're paying cash out of their pocket until they meet their deductible. So, I mean, if I were a patient, and I think probably in the next 10 years, if you want really good medical care, you're going to have to pay cash no matter what.
It's really looking that way for sure.
I mean, it's going crazy.
I can tell you, yeah, with some of those deductibles, our cash programs, it beats them.
Exactly, right.
They prefer to go to our cash, right?
Right. I mean, insurance is so hard to get good insurance nowadays that you can charge cash and still be less than a lot of the insurance deductibles that people are paying.
Absolutely. Yeah. That's a relief for the patient because they're looking at their high deductible, $10,000. And I say, well, we can lick this in this program. It's, $2,200, $1,700 and we're done. And if you can come with, again, that right conversation from the get-go, and offer that to them, then you just did a huge relief. Say, oh, great, I'll have to, meet this deductible. We can start right away. That's,
and with those services, dry needling stuff, I mean, that's a totally one-on-one personal treatment for people that you just don't really get at most physical therapy places. Right. I mean, as we know, you're going to be being treated by the same therapist and they're going to be treating another, one or two people at the same time. But with your services, I mean, those people your patients are getting one-on-one treatment. They have all the time they need to talk with the therapist and stuff
because they're paying for that. They're paying cash for that. So
they're not getting the same type of services as they would using insurance almost anywhere else. So they can pay cash.
Well,
it's not very much different from regular insurance price, and they're getting much better treatment overall.
Well, yeah, they're paying for that one-on-one time with the doctor of physical therapy. That's putting those needles in their body. That's a lot of time that must be, reimbursed or paid for, right? And they're paying cash for that. So 8 hours of the day go by and that therapist is now seeing a lot less volume. He's happier. Those clients that he is seeing are getting, a variety of great therapies and the physical therapy. They're getting better. So it's a win for everybody. I really feel like it's the way to go. And you're helping them avoid those huge deductibles that they have to chip away at the year. So yeah, definitely, Jason, but it goes back to like, how do you present this to them and how do you sell it? Because I know a lot of therapists, they have that fear. Oh my God, I got to sell now. That's so scary, but you shouldn't look at it like that. It's not like we're car salesmen. We're doctors of physical therapy. We're trying to help people. We just need to bring some clarity to the situation. What is their current situation? And ask them, what is the difficulty that you're having, or what are the things that it's difficult to do because of your pain? And they'll tell you, well, I can't, bend over and play with my kids, and I can't, play golf. I can't, do any rock climbing. And we keep asking them about, well, why is that important to you? Why is that such a big deal to you? And they oftentimes they get emotional. They get emotional, and they're just emotional because no one's even asked them that. So
I mean, I think that's such a huge aspect of physical therapy that it seems to me that it's starting to catch on a little bit more, because I've seen a lot more like concierge physical therapists out there, and providing more personal service. But I mean, as anybody listening to this knows that's been to the regular doctor, I mean, most of the time you don't even get to talk with the actual doctor. You talk with an assistant or something like that. And I think the average time you actually speak with them is like, it's like less than 5 minutes. And they're in with us for half an hour or a full hour. They got our full attention. And a lot of this stuff, regardless of why it started in the first place, like you mentioned, like if it's back pain and they can't do stuff, it becomes a psychological issue super fast, right? So I think that's a really under realized part of
right.
dry needling, especially the way that we teach, and targeting the autonomic nervous system towards homeostasis. That really, really helps with people's psychological issues. You'll see
Yeah.
really dramatic changes in their personality in a positive way. They won't be kind of as antsy, and
Oh, absolutely.
a lot of that's from decreased pain, just improved ability to do stuff during the day. People don't
Yeah.
realize how valuable that is.
Yeah. I mean, you see those outcomes, like those local outcomes that you're hoping to get on those muscle groups. And you know, you could even see that, like what you said, when those effects go systemically and just bring them down to more of a homeostasis, more relaxed. And there's some programs that we sell are just for that, just to help with people's anxiety, so that their body functions properly. That's huge. That's a huge part. And going back to the sales, I was telling y'all about bringing clarity to the current situation, and patients even get emotional, which oftentimes they do because they're just so wound up. Then we go further into the conversation, and we just say, hey, what would you love to see happen? What is your dream, outcome here? And really bringing that clarity on the table too, and get them to verbalize it. And once you have that, all you do is just position those services that you think will help them, which is the dry needling and the physical therapy, as that bridge to go to from the current situation to their outcomes, just their dream outcomes, right? And that it's an easy sell at that point, Jason. Seriously, I mean, and it's not like we're sleazy car salesmen. We're just being who we should be, a healthcare fiduciary. That's what we are. We want to help these people. We're their advocates for their health, and we're trying to find the best tools to get the job done.
And just the simple fact of a patient coming to the realization that this person is actually like legitimately trying to help me, and they care what I say and stuff. I mean,
Assume that role.
I know from my own experiences with doctors, and just, I mean, in general, you don't feel any type of personal connection with them. A lot of the time, they don't even put their
Big
hands
mistake.
on you and touch you,
Yeah.
and you're just treated like as a number. They have these certain medicines that they give people,
Yeah.
and it's not really a personalized treatment like you get with that type of physical therapy.
Yeah. We are physical therapists. We are therapists, right? We are their healthcare fiduciary. We got to assume that role and let that conversation reflect that. And I think that kind of tone is huge, right? I mean, the tone can direct a conversation in one direction or another direction. But if you use that tone as a healthcare fiduciary with that kind of certainty on what will help them get better, I mean, it's an easy sell. It's an easy sell. And at that point, that's like, when do you want to start? Assume it. Don't ask them, do you want to start? Or no, just assume we could start today, or is that fine with you?
Right,
And
because they're there because they need help, right? If they knew how to fix themselves,
absolutely,
they wouldn't be there. So they're not
exactly.
they're not looking for you to ask them,
Yeah.
how they want to, they want somebody to tell them what's going to work for them and
And
get
that's,
better.
yeah, that's another, and I would say that's maybe the second biggest mistake that a lot of therapists do is they don't assume the close. They don't assume that they're ready to go. They want to get better. And we need to do that more, have that kind of conversation, bring that kind of clarity and assume that close. And I think if y'all do just, if you, from this talk, if y'all just get those two things down, I'm here this week. If you start implementing that, I know that y'all gonna make some more sales.
Okay, so like if you could just like in summary, Mark, as
Yeah.
far as if you were talking to a student of mine that was a clinic owner and they were trying to decide if they wanted to take a dry needling class and implement in that into their practice, what would be like the biggest benefits that you would say, or the biggest takeaways as far as just overall effect on the business, patient outcomes, and stuff like that?
For benefits, yeah, first for the client outcomes, yeah, I mean, so systemically, for people that have a lot of they're in a lot of pain, it can really bring down pain. It can bring down the intensity of the person as a whole. It'll help them with overall outcomes in just the way the muscle performs. For places talking about muscle activation again, where you see a lot of just disconnect with the activities they're doing, it brings activation again better. And then healing time for places where there's a lot of inflammation. You can use those needles to really spur up some healing on those local inflammation tendons or muscular tendon junctions, things like that.
What
So
about for like, since you guys do a lot with palsies, what is the difference that you see when treating palsies with needles compared to without needles?
a game changer, honestly. Like, it's just another great tool to bring awareness to the body, to activate muscles again, to spur some neurological muscular tendon reconnection to between the muscle and the brain. I mean, that's huge. You could use that with electrical stimulation as well. So we used the combination of that as well with the needles. I mean, all of that is to help them to reactivate those muscles that are just not kicking in the way they should. And that happens throughout the whole body, not just with facial paralysis, but like, with the cross syndrome, lower cross syndrome, upper cross syndrome, things like that. You can apply the needlework to that too. So for patient outcomes, I would say, that's when it's indicated a lot, right?
I mean, yeah, when I always tell people, I don't think there's a living person that wouldn't benefit from the proper
Yeah,
needling, right? Because nobody's got a perfect nervous system, and a
exactly.
healthy nervous system helps with every medical condition that I'm aware of.
Exactly.
Just so before we go on to the business side of that, just a quick story. I wrote an article on post-shingles neuralgia on our blog page on our website a while ago, and I got this call from a random lady in Florida, and she was like, "Hey, my husband had shingles in his glute. It was his left glute, and he was a totally healthy guy and had been in a wheelchair for the last year because the neuralgia got so bad after the shingles went away. And I mean, they went to all the correct doctors. They tried regular physical therapy, massage, gabapentin, morphine,
Mm.
nothing worked. So they flew out to Nebraska to see me, and I treated him 3 days in a row. And after that 3 days, he was like 85% better. He was up walking around. So
Incredible.
it's just one of those, and not like that happens every single time, but you see so many amazing examples like that. That
Yes.
it just really, it's awesome for the business side and the patient side as well. So as far as the business side goes, what are like the main benefits you see as far as a business owner implementing dry needling in a cash based scenario like that?
Well, I mean, immediately you'll see money being generated, right? That's like you don't have any kind of like time between the doing the service and getting paid. Like they pay you first. I mean, that's
Yeah,
great.
you're not waiting 3 months for
Right.
insurance
There's no
reimbursement,
administration costs.
which you may or may not ever get. Yeah, exactly.
There's no administration. You don't have to pay anybody to send a bill. You don't have to pay a biller. Are y'all tired of billers? I was. No, it's just cash right there in the clinic. They prepay for it. So that's great. Immediately cash. The the business also benefits from more stability, right? Now that we're generating cash immediately and the volume picks up with the cash services, now we have more stability even on low times when there's, the holidays or during low times with the new year, the high deductibles, that we still see our cash services being paid for, and it brings some nice stability. We can have some decent sleep during those times.
I mean, it increases your profit margins by a significant amount, I would think, right?
Right. And don't forget the long-term value of that patient increases, right? What I said before, they're coming in, after they're done with their bout of physical therapy and needling work, if they're an active adult or if they're, maybe a young athlete or even an older person, if they're trying to stay healthy, they may come in for another checkup to something else is hurting
Man,
them.
that's a super good point that I think a lot of people miss out on also with the cash business is, unless you're extremely wealthy, you're not going to be able to afford going in and getting needled every single day and paying cash for it, nor would you need to. But the way that a lot of it works is you'll see people for however many visits, get them to the point where you think as good as you can get them, and then they may need to come in just once a month or once every 2 months just for a little bit of a tune-up. And if you get enough of those people, I mean, there's a big difference between going in and giving some cash once a month compared to every day, right? So if you get enough of those repeat customers that just need to come in and do that once a month or once every 2 months kind of tune-up treatment, that's easy for them. It's not financially taxing. And
Absolutely.
On your side, that's just a huge, constant stream of cash that your business is getting.
Right. I mean, it's up to your discretion if you want them to come in a month later or a quarter later or, 6 months later. But I mean, even if you don't have any kind of like system where they come in after they complete their plan of care, if they got results, they'll come back to you. I mean, you just generated another client just because of you're offering something that's very specialized. It brings quick results. It's going to increase the long-term value of that client. And because you're doing something very special that not a lot of places do, now you're having that reputation of, hey, now I'm a dry needling therapist, and that's going to generate some referrals from your past clients. But yeah, I mean, all those things really help the business part of it. But there's again that fear for selling, and guys, it starts with y'all. It really starts with the physical therapist. And like I said before, if there's anything to take home from what I said, just two things: have that conversation, make it super clear that they understand where they are at, which is usually when they first see you in a lot of pain and really poor function, right? And really get to that emotional part, and then bring that clarity as well with their desired outcomes. And then the second advice: assume the sell. Assume they want to start immediately. Don't ask them if they want to start. Just, when do you want to start? And if you just do those two things, to have that clarity and make that assumption that they're ready to go, I think you'll see quickly an increase in sales for sure.
Cool. Well, so where can people find you, Mark, if they're looking for you?
Yeah. So at this point, y'all can email me. You can email me at Mark at Optimum Physio Therapies. You can. If you have any more questions about sales, I'm actually helping a lot of therapists around the nation and Mexico as well with bringing more value in the clinic and helping them to bring cash services in the clinic. And yeah, just shoot me an email. We can talk more in depth about what me and Jason were talking about. And that's probably the best way that they can, just have some more conversation about this.